And Dr. Paul, I figured I'd chime in on the hottest news story of the week, which is the Tylenol autism story. I'm posting this video for two reasons. One, dozens of people have asked me what my thoughts were on it, so I figured I'd share it with you also. Two, with all the heated emotions, political positioning, and misinformation, I figured I could share some points just to clarify some things and maybe share some insights that might help. I don't know. So I had 6 points. First, number one, autism is the biggest concern we have right now. I think it should be our number one priority in this country. Kids are having trouble. Rates are going up. Right now, 1 in 31 kids have a diagnosis of autism. That's shameful. That's crazy to me. And I've been watching it happen for the last 2 decades go up. So we need to check everything, question everything, consider everything, leave no stone unturned. We have an obligation to do that. We need to figure out autism. That's number one. Two, the story that came out said that there was a possible link between Tylenol during pregnancy and an increased rate of neurological conditions such as autism and ADHD. Possible link. So that piques our interest, warrants more studies, and will push us to look into that deeper. You will hear arguments, the biggest argument, and people complain and say it does not prove that Tylenol causes autism. No one's saying that it proved that. They're saying there's no causal proof. There's no studies that show causal proof. No, that's not what anybody's saying. What they're saying is there are several large studies showing an association between a possible link. And that is the start of most things. Like right now, there's a possible link between Benadryl and dementia. There's a link between antacids and certain cancers. At one point, Vioxx, there was a possible link between Vioxx and heart attacks, which led us to dig deeper and find out that there was. And then we found out that they was causing that. So it starts with a possible link. So that's it. No one's saying it proves it. It's saying there's a possible link. Which leads to the third point, which is really they're putting a label on the bottle. They're not banning the stuff. They're not telling you can't buy it. They're not telling pregnant women they can't take it. They're saying, here's some information to help you make a better decision. That's it. And there should be a label. If there's a possible link, I think we should know about it. I'm glad to know about it. And it might be one step closer to figuring out a cause of autism. Fourth point, obviously it's not political. People are freaking out about Trump or RFK Jr. They didn't do the studies. They're presenting the information. Yes, they may have an opinion on it that you don't like, or they may present it in a way you don't like. But the studies came out of high-level institutions with reputable scientists, places like Harvard, I think Johns Hopkins, Mount Sinai. So it wasn't a political party or the administration. These are scientists, So anyway, so it's not, don't let your political emotions clout a scientific issue. So point number 5. And I realized this morning, a doctor was holding up a sign that said, "Dear mothers, you did not cause your child's autism." That's the first time I really realized or thought about it this week, that yes, women are going to potentially blame themselves if it is a fact that they took Tylenol and that was the cause of autism. But there's no room for blame or shame. Mistakes happen, things we don't know. Being mother is the hardest job on the planet. Mistakes happen. I mean, it wasn't that long ago where women were drinking and smoking and doctors were saying it was okay while they were pregnant. I mean, that wasn't that long ago. So, and now we know more. So I would be more excited about the fact that we're getting some information so that we can get better outcomes in the future and maybe stop this thing. The sixth and last point I want to make is Tylenol is not a cure for anything. We're not anti-medicine, but you know what? There isn't a single condition out there that is the result of an acetaminophen deficiency. Therefore, more acetaminophen will not correct your health problem. So if you have headaches, back pain, neck pain, joint pain, I mean, Tylenol in a long-term use is never a solution. It is a thing that you can use to buy some time till you get some kind of correction. And there's more natural, safe remedies out there and ways of dealing with these aches and pains and even headaches, migraines. I see them every day in my office. We help thousands of people in my office through chiropractic care. And we've got, there's acupuncture out there, massage therapy. These are all natural, proven, healthy, safe, and affordable ways of treating some of these conditions, even during pregnancy. These are all three of those are valid treatments or ways to take care of problems while you're pregnant. So consider that. I mean, Tylenol, even though it's an over-the-counter drug, is the #1 cause of acute liver failure in America today, acetaminophen. It's responsible for hundreds of deaths every year. It's responsible for thousands of ER hospital visits, and is responsible for tens of thousands of calls to the poison control centers. So it's not something that no one should ever take, or I think you're crazy for taking it. I'm sure we have a bottle of it in our house, but it's not a solution. So look for more alternative, safer alternatives, and you'll be better off. Anyway, no shame or blame. I think we need to look into every single thing possible. I think the information is exciting, not misleading, and I think people then can make their choice, and that's the greatest thing. You get to make your choice. So anyway, I know that's a lot of stuff. Last thing, check out the lake behind me. Beautiful view. Hope you have a great weekend, Cody. All right, enjoy your weekend.